have a friend who's a doctor who walks the talk. He's a mountain climber. He's lean and he's not a real big guy. And I've just changed my whole concept. And I'm still engaged in the process of exercising more for building muscle, but I'm learning more about this particular program, how you balance it out calorie-wise to be able to do just that. And I definitely want Steve to comment on this because he really is good at describing this better than I am as far as how the program works. But it really changed my whole concept. I was fixated on the gut because of my low back, and suddenly I thought I had a fat neck. I didn't know I had a fat neck. This weight disappeared in my neck. And like Nancy said, it was like all parts of your body, and I found out what obliques were. I didn't know what obliques were. There they are. And I haven't even done any, hitting the ab roller and the weights in the gym thing. And so that whole concept began to change. And I did chuckle when you mentioned, that was a great illustration about our grandson's weight equivalent to what Nancy lost, because I love my 4-year-old grandson. But I'm a typical male. I think about the free weight plates on the bar in the gym. I picture a 25 and 35-pound plate coming off of your body, but that's not a girl thing, so sorry.
Or you can take a loaf of bread at the grocery store and say, this whole loaf of bread is the size of all that fat, 1 pound of fat. You can just do all sorts of stuff.
I don't like that.
I love the bread that we love. Well, it's important to kind of come to terms with the reality of it, especially like, Nancy, what you said, when it's distributed throughout your body, it creeps up because it doesn't totally change the way you look. And then suddenly it begins to lob on in ways that you really know is not the way you want your shape to be. So it's a process. Well, Steve and Jenny, you are there so quietly listening to these people whom you have mentored, and it's time to hear from you. I don't know if you want to tell about your own story as a backdrop to this and your own success, or do you want to just leap right into the information about the program? Because I'm sure everybody listening is really eager to find out about this.
Well, hi, Carol. This is Steve, and thank you so much for having us on your program. It's really a wonderful opportunity. And I'll tell you just a little bit briefly about, my weight loss story. And I did lose 44 pounds.
Nice.
It came off rather quickly. And it really improved my cholesterol and my blood pressure, just like Dave's experience, just incredibly. And so it really changed my mindset from how I thought we were supposed to eat, just like the 3 squares, and now I eat a number of several low glycemic, low-fat meals throughout the day, and it really balances blood sugar levels, and those are some of the things that have made me feel personally so much better. But I think what really makes this program unique is the incredible network of support that clients have available to them, and probably just as importantly, if not more importantly, the focus on creating health instead of simply reacting to disease through quote-unquote dieting. I would say really what we are is more of a vibrant grassroots movement of health coaches, health professionals, and a lot of clients who are really redefining the path to health and well-being. So this is a whole new approach in the weight loss industry.
Okay, so then you have a network of clients that you support, and then Dave and Nancy were among them. Is that what I'm understanding?
Yes, that's exactly what happened. We actually didn't coach them personally on the program as much as we have coached them as coaches and helped them to help other people, and so they are supporting a lot of clients. And I've got to tell you, we're just so proud of them and so happy and fortunate to have them in a team with us. We really appreciate all of their efforts.
Oh, wonderful. Well, I do think that the statistics, Steve, that I've looked into over the last 5 years indicate that programs that integrate social support actually have a much higher success rate than programs where people are just going at it alone. So it's beautiful that this program integrates that interpersonal part of people who have gone through it and then want to help this other person experience this vibrant life. So that is a great component of this program. And Jenny, hello, how are you?
I am just great. Thank you so much for inviting us on to your radio program as well. What a thrill.
Oh, well, I'm honored. So, Jenny, tell us a little bit about your journey and your process also as a mentor in this particular path.
Well, sure, I would love to. Steve and I began this journey almost 5 years ago. So part of our success is not only did we create health, but we learned the tools to maintain it, which is what everybody desires and which is why our program is so beneficial to so many. And while I did not have a huge weight loss story like Dave and Nancy and my husband Steve, I did lose 12 pounds, but what I like to tell people is, you know what, the amount of weight that somebody has to lose is not as important to me as that person's ability to keep it off. So you can imagine how easy it would be to put back on 12 pounds in almost 5 years. And so I thank our program for giving me the thin, healthy mind that has allowed me to maintain. So, and part of that is learning about the glycemic index and basic nutrition, which, you know, honestly is information that a lot of our health professionals, our personal doctors, don't really have the time to sit down and chat with us about. Mm-hmm. So do you as coaches interface with medical doctors that say, hey, I have this client, I don't know how to help this client, please help us? I mean, do you do that as well? Yeah, we absolutely do, and we actually do have quite a number of healthcare professionals who are actively involved in this program and coaching their patients.
Nice.
With implementing what we have. So it's definitely, you know, part of why we're unique is that we're medically backed and supported. So not only do we have the component, which I feel is the most important, which kind of is a backdrop to what you were saying, Carol, with, you know, the support, we have your health coach who's, you know, with the client every step of the way. And whether that health coach happens to be a doctor or just someone, you know, regular people like those of us on your program today, we're coming alongside people and supporting and guiding them through the journey. And it's very relational on that standpoint. No one is doing it alone. And then having the medically backed eating plan is definitely a bonus. And then the health education system, which was paramount for me in my 12 pounds of maintenance. And I just wanted to touch a little bit on the discussion of muscle, because after the age of 20, we start losing a pound of muscle a year if we're not doing strength training.
Right.
And a pound of muscle can burn, you know, up to 70 calories in the day. So by the time we're 40, we've just restricted the amount of calories our body can burn by about 1,400. And so we find ourselves in middle age going, wow, I haven't changed my eating, but why am I putting on this weight? So one of the wonderful things about our program is it does provide that adequate protein, which allows us to preserve the muscle mass, and then we really encourage clients to start moving again. You know, maybe some of them haven't in a long time.
Right.
So, yeah, so it's just a wonderful component.
Can I interrupt you for just a moment? And Steve, Jenny, Dave, and Nancy, here you are. You're all mentors of other people. And I'm understanding from this program that the mentoring that you offer is actually cost-free, and that in addition there's also access to, am I right, medical professionals and psychological professionals that can give you moments of tips about how to progress? I mean, maybe I don't have this quite right, but help me understand what the configuration is and the availability of the coaching.
Sure. Yeah. Dave and Nancy, you want to talk about that?
Yeah, I can talk about that. We have a bio network of doctors, of nurses, of nutritionists that clients have free access to.